we can come back and ask additional questions of the panel, but first I'd like to invite Gail Reed to talk about the barriers to some of these advances and innovations to Americans learning from or benefiting from these, and how we might succeed in making this available to Americans.
Supposed to go up there. Huh?
Yeah.
Okay. I can do that.
Oh, and when you do have questions, let me point out there are 2 microphones in the room, so please step up to the microphones if you have any questions.
Well, before taking this on, to follow up with Barbara's comments, I just have to say that I think President Obama has already made some overtures about U.S. collaboration with Cuban teams abroad in disaster situations, and that's something that I think the U.S. and Cuba are actually duty-bound to do. We have tremendous technology in this country. We have tremendous logistical resources. It was great to see those Cuban doctors working in U.S. hospitals in Liberia, but all that happened on the ground, and it could have been part of policy on both ends. So we've heard a lot today about some of the Cuban experiences and some of their innovations that Americans can actually benefit from. Everything from this diabetes treatment that isn't available yet in this country to strategies that might better protect us in disasters, to tests that on promising vaccines, also not in trials yet in the States. The debate on lifting the embargo, as we know, is going on in Congress and will continue to go on in Congress. But frankly, we here at MEDICC believe that our Americans' health should not suffer in the meantime. Stated simply, it just can't wait. We can't wait. We have to do something about it now. So that brings us to the heart of the matter. What is possible to do, even under the current set of regulations, especially as we look at this new opening offered through diplomatic channels? So here are some things that the administration, with some executive authority and a little push from, a little nudge from all of us, could do. First, they could treat applications for Cuban drugs the same way that we do a drug from any other country. In other words, it would go through the same FDA process and not be subject to Treasury Department licenses that simply add layer upon layer upon layer of the process. Right now, how does it work? It works that first they issue, or not, Treasury, the OFAC, a license to do clinical trials. These are trials that in phase 3 cost $30 to $50 million. They've now made it a policy not to issue the second part of the license that would say, well, if the FDA approves your medication, then you can go ahead and sell it, make it available to doctors and patients in the U.S. They don't say that. And unfortunately, we have the experience of Treasury approving a license for an X-ray machine that's used literally for a broken arm. We're talking not now high tech. And then not approving the license for the spare parts to repair that X-ray machine. So this is a little bit of a similar case. My question is, so what company is going to spend $30 to $50 million to run clinical trials, however beneficial this drug might be, as in the case of the diabetic foot medication, without any indication that even if the FDA approves this medication, they will be able to market it in the United States? Conclusion, the trials are not happening. And that's precisely what has happened with Heberprot-P. The Cubans should, by the way, get better at their marketing. Heberprot-P is not exactly a very easy term. Anyway, what can the president do? He can issue a general license to eliminate this Treasury step. And I think it's extraordinarily important for people in our country. What else can he do? He can issue a general license to allow U.S. pharmaceutical and medical equipment companies to carry out trials on their own drugs in Cuba that involve Cuban institutions to potentially speed up their availability to patients in the United States and elsewhere, of course. As Jose Luis mentioned, Cuba has a public clinical trials registry, the first, as a matter of fact, in Latin America, accredited by the WHO, and they have significant experience in multi-center clinical trials. I remember a few years ago, Dr. Kenneth Bridges from Brigham and Women's Hospital at the time came to Cuba, and it's the first time I really realized the reverse impact of our policy, that Americans' health was being damaged. He said, you know, we were testing a drug that was already approved by the FDA for something else, and we were testing it to see if it would work for sickle cell patients. And we spent an awful amount of time in this multi-center trial looking for the patients that would participate in this trial. If we had been able to include Cuban institutions in these trials, we would have been able to get this drug to the patients 1 year earlier. So there's a real advantage to patients and obviously to companies to be able to involve Cuban institutions within the regulatory framework designed, in fact, after the FDA in these kinds of trials. Cuba, by the way, should also be able to buy medicines from the United States. This is one area that has not really been affected by the relaxation of the regulations. A few years ago, we saw food being able to be sold to Cuba with some kind of onerous complications like cash on the barrelhead, but not even that applies to medicines or medical equipment. There is still a very lengthy, tortuous route to be able to sell from U.S. companies medications or medical equipment to Cuba. Next, while drug development is important, let's not forget about ensuring access to those in need of life-saving medications today. All of us, most Americans, would love to be treated in our hometown, certainly in our home country. But right now, the case of a diabetic seeking Heberprot-P to avoid an amputation, their only option is to go to Cuba. But law, U.S. law, prohibits them from going to Cuba to receive that treatment. They can only receive, we can only receive medical treatment in Cuba if we're already there and happen to get sick, but not if for any kind of novel treatment or any kind of treatment for a chronic condition. What can the president do? He can issue a general license, again, to allow Americans to receive medical care in Cuba and, in fact, for their family members to accompany them. Finally, the exchanges, as Barbara mentioned, between our two medical research and disaster mitigation communities simply need to be made easier. Recent developments are heartening in bilateral government negotiations that point to some movement in this direction. I'm going to give a lot of acronyms now. The CDC, HHS, NIH, NOAA, and FEMA, a lot of people under those acronym umbrellas, they need to be able to freely talk to their Cuban counterparts, to cooperate, in fact, with those counterparts. That mosquito that carries dengue, it's all over Latin America, all over the Caribbean, and Cuba has the only WHO PAHO Collaborative Center in dengue research. Why is that important for us? Because climate change has carried this wonderful mosquito with the striped legs, the Aedes aegypti, all the way up to California and to San Francisco. The entire southern United States now is at risk of dengue fever. And by the way, dengue fever kills. Cuba's got the center that has the most research on dengue in the Americas. So our people need to know what the Cubans have found. And we need to know what it is that we can do to prevent this disease from really being an important and dangerous infectious plague on us. And finally, let's not forget on that note that people in both countries can become victims of new infectious threats like SARS, like Ebola, like others, emerging, re-emerging infectious diseases and viruses. For the health of Americans and also the health of others around the world in this very small planet of ours, we need cooperation between our public health institutions and those in Cuba. It would make for a healthier future for all of us in Cuba and here in the United States. Be happy to take questions.
Bob Griss with the Institute of Social Medicine and Community Health. I'm very interested in this comparison of the U.S. and Cuba because often when the U.S. is presented on lists comparing itself to other countries, not only don't we look good, but Cuba is never on the list. And I'm thinking that MEDICC is one of the few organizations that's in a position to make a comparison more meaningful, not specifically on a particular treatment like this diabetes foot problem, but more generally in showing the value of public health. In this country, since ACA, even though we have a prevention fund, there's been a decline in public health funding since 2008. Some recent studies have demonstrated through APHA. My point is that Cuba represents a country that has taken public health seriously. The U.S. has gone in the opposite direction. I think the American public needs to understand the real lessons that can be learned from the Cuban experience. And then I think the momentum will follow to address some of the recommendations that you've made here. But I think the American public doesn't know or believe that Cuba is accomplishing so much in health improvement with such limited financial resources. And I really look to MEDICC to tell that story.
Thank you for that advertisement. No, I take your point very seriously, and I think it's a broader discussion about public health in the United States. Many of you I know are working on health legislation and trying to bring more public health into what is a very biomedically centered health system. I would just like to say, so that it doesn't end up being a total advertisement, that there are a number of very sort of not the usual suspects that have been looking at Cuba. One of them is Save the Children, declaring Cuba the best place in Latin America to become a mother. The other is Bloomberg of Business Week, who has a health rating, and it's quite interesting to see the relationship between Cuba and the United States. And that is not to say that we're doing everything wrong, and I want to make that point. I think also the Cubans have some things to learn from us. This is a cooperative venture, so I think that's the other thing that MEDICC would like to bring to the table. The Cubans are very interested in learning from us. There's a delegation coming in January taking a look at patient safety, efficiency, quality care management in the best practices of our best hospitals. So they're willing learners, not just folks that have an idea that they do it all best. They don't think so, and in fact, I think that is what is part of their secret. There is kind of a syndrome of eternal dissatisfaction among Cuban health professionals that say, how can we do it better? So thank you for your comments in any case.
I'd like to add to that Cubans do an amazing job with very few resources. Here we have all the resources and we don't do as good a job as we should be doing. So do you want to step up to and join the panel? So, you know, the Affordable Care Act is great legislation, but the only thing that's really been implemented is insurance reform, as you all know. That's great. That was sorely needed, but all of the facets of it that have to do with prevention, with improving the delivery of care, with being able to cut costs. All of these things are more aspirational than real. And as the gentleman was suggesting, they can't happen without public support, without funding. Another thing that I'd like to add to what Gail was saying was I think we're here with a bit of a sense of urgency. It's been a long time that MEDICC has been in business for what, 20 years, almost 20 years. We're strongly aware of these issues. We're aware of where Americans have been missing out. We're aware of how the Cubans have been adversely affected by what we call the embargo and they call the blockade. So we think that if this opening is really going to mean anything, I mean, it's great that travel restrictions have been loosened, that more Americans can go to Cuba, and there are more changes in the offing, but frankly, this is really much more important. And if we're going to be serious about this rapprochement of going beyond the reestablishment of diplomatic relations, making it easier for Americans to go to Cuba, now is the time to act. And there's, as Gail was suggesting, there's a lot that can be done.